The state health department, we want to move on to another big story, says that emergencies related to recreational nitrous oxide use are up big time. That's also known as whippets or laughing gas. You may have heard it. I'm joined now virtually by Haley Cahus, the manager of the Opioids and Emerging Drugs Unit at the state health department. Haley, thanks so much for being here and talking with us about it. There's some pretty startling statistics that the state health department put out talking about this rise in these emergency situations. Can you talk to us a little bit about first what this substance is and how it's used and how it works?
Yes, thank you so much for having me. So nitrous oxide is used medically as an anesthetic, but it's also used commercially in cooking to aerate or infuse ingredients. So because of that, it's very widely available and somewhat affordable. And so people are using it recreationally, but it has very serious adverse health risks associated with it. And we want to make sure people are aware of those risks.
Yeah, absolutely. And one piece of information that you guys put out is that this often comes in fun flavors. It's often marketed to young people. We've seen that happen with vape products and such. Is this a problem specifically with young people, or is it sort of all age groups?
Yeah, we're seeing cases in all age groups, but the majority are among young folks, especially ages 20 to 39. Over 70% of the cases we've seen so far are in that age group.
And obviously the word emergencies is nothing to take lightly. When we're talking about emergency situations related to the use of this recreationally, what are we talking about? What is sending people, to get medical help?
Yeah, so the symptoms with its use can range from some weakness, numbness, tingling, loss of sensation in your arms or legs, memory impairment, delusions, depression, or mood changes. And they can range from those all the way to very severe effects, such as hypoxia, which is low oxygen in the blood, and asphyxiation, which can lead to death. So it does range, but they can be very serious.
Yeah, those are obviously a range, like you said, but really serious situations. What are you guys just hoping, as the leading health agency here in the state, hoping to get out, by talking about this and putting out these numbers that we've seen this rise in the last few years? What are you just hoping to accomplish by spreading the word about this?
Yeah, mainly two things. We want the public to be aware that there are very serious risks associated with its use. I think there's this false perception that because it's so widely available that it's safe and legal, but that's certainly not the case. It can be very serious health outcomes associated with it. And then secondly, we want healthcare providers to be aware and to take this in consideration if they if a case presents to them with some of these symptoms that nitrous oxide may be the reason for these symptoms showing up.
Yeah, absolutely. And I know you went through kind of a range of different symptoms that can happen here as a result of the use of this. But as far as long-term effects or, effects that could last for many years or maybe the rest of your life, is that what we're talking about here as well, with really long-lasting impacts on people who use this, maybe only a few times?
It's hard to say in the data so far. We've only been collecting like the last 5 years. So unfortunately, we don't know what the long-term effects could be with recreational use.
Yeah, absolutely. And I think something that you pointed out is really interesting too, that, you can get this easily. This is not something difficult to access, like potentially, other drugs that are out there that people use recreationally. I'm sure that sort of convolutes the message a little bit or confuses the message a little bit that, yeah, this is out there, you can get it, but it is really also so dangerous, especially for young people.
Yeah, absolutely. And I think it's the breadth of where it's available is very confusing because it is available in grocery stores, convenience stores, smoke and vape shops, and even online.
Yeah, definitely. I was looking online. Yeah, you can just go online and buy it. I was looking earlier just to get a look for what it looks like. As far as if parents are watching this and, maybe some of these symptoms they've seen, in their child or teenager or what have you, how would you suggest they go about, talking about this with a teenager?
Yeah, I would start just by letting them know that, chronic use does lead to some very serious things and that you want to take those seriously and that if they are experiencing any symptoms that they should stop or reduce the harms and seek care immediately.
And as far as the addictiveness of this, I'm not super familiar. Is this something that's easy to get addicted to? Is it not so addictive? How does that work when it comes to this specific substance?
Yeah, I'm not a addiction specialist, so I'm not sure how addictive it is, but it does produce a very euphoric state, which can always be addictive.
Absolutely. And if someone's watching this and maybe they are using this substance and they're looking for help, I know that the state health department has a lot of resources. Can you walk through it all, just, the ways that you can get help if you're struggling right now?
Yeah, I would certainly encourage you guys to go to the MDHHS website. There are plenty of treatment available, options available on our website. And if you are experiencing, some effects acutely, like right in this moment, I would seek emergency care through 911, the emergency department, or calling poison control.
Okay. Haley, anything that I haven't asked, anything else that you'd like the community to know about the rise in these emergencies related to nitrous oxide?
No, I think we've covered everything.
Okay, awesome. Thank you so much for joining us on Evening Plus and talking about this important topic. Hopefully we touched some folks that, may not have realized just how dangerous this is. I really appreciate your time tonight.